Hi, what's up, guys? I'm Dr. Gurpreet, a general dentist at Toothland Dental, located at 345 Queen Street West in Brampton. I wanted to make a quick video today regarding dental x-rays and why they are so important. Granted, they may seem redundant at times, but there's always a reason why we prefer to regularly update your x-rays, or well, depending upon your treatment needs, update your x-rays. And I wanted to demonstrate this by showing you a case example. We had a patient who came to us. Even he was referred to us through a friend of his. And when he came in, we planned in initial checkup, and part of the checkup was to take his x-rays. Now, this patient had been going to a dentist for the past, I would say, 6 to 7 years, but only had his x-rays taken once in the past 6 to 7 years. And when he came to us, he insisted not to have his x-rays taken, and his reason was they were not necessary. After kind of going back and forth, explaining him what we're gonna look at and why there's a need to check for why there's a need to take his x-rays. Obviously, the obvious things are to look for any cavities, to look for any gum disease. That's in an advanced stage. But other than that, one more important thing is that we also check for any anomalies in and around the teeth, especially the jawbone area. So, after about 5 minutes of educating him, he was ready to get his x-rays taken. So once we took his x-rays, there's something that kind of piqued my interest, and I want to actually show you his x-ray to demonstrate what I mean when I say something that piqued my interest. If you guys look here, so this is the x-ray, but I want you guys to focus on this side of the x-ray. Besides the fact that the wisdom tooth on this side is kind of laying downwards and towards the bottom of the jaw, but more importantly, what I noticed here was a slight shadow kind of encircling the tooth. It's this white outline right here encircling the tooth. So that kind of got my spidey senses going, and I figured this needed to be further investigated. So what we did was we referred him to get it checked out further, and then we've just recently found out that it was a type of a cyst, kind of in its early stages. Nothing too serious at the moment, but something that needs to be treated, something that needs to be dealt with. If left alone, obviously it can grow and expand and cause damage to the surrounding areas. As a clinician, as a dentist, not only that, I'm glad that we were able to convince him to get the x-rays done, but the patient is glad that he got the x-rays done himself, to a point where something was there and we were able to detect it, and we were able to kind of refer him or direct him towards the path where he could get it treated, and not kind of wait until the last minute when it's a bigger mess, so to speak. The message is that when you come here at Toothland Dental, what we do is we sit down with you, we discuss all your, whatever it could be, your any questions, any anxieties, any concerns that you may have regarding your dental treatment, and we always want to go through a science-based approach and educate you guys. And the main reason behind that is we want to make sure that when you walk out of here, you're completely satisfied with the treatment that you got. And don't get me wrong, I'm not saying that x-rays need to be taken every time you walk through the doors. We here at Toothland Dental always sit down and look at what your needs are in terms of your teeth, what your needs are in terms of your gum disease, if you have any, what stage is it, if you have any cavities, what your past history has been, what your past dental history has been, and with that we come up with a custom plan that includes when you need to come for cleaning, when you need your x-rays to be updated, if at all. You know, it could be 2 years, it could be 3 years. We don't need to update your x-rays. So it's really tailored to you. But the important part is that whatever we do here at Toothland Dental, it's always scientific based, and we want to make sure that we don't miss out on any little details that may down the line cause a bigger problem, or it may end up being a bigger mess. All right, so thank you for listening, and remember to brush and floss every day, morning and nighttime. Bye for now.